Good morning. I am Michelle Spencer. I am the Associate Director of the Bloomberg American Health Initiative, and it is my pleasure to welcome you to the Bloomberg School of Public Health and to today's symposium on transforming environmental health. Let me also mention logistics for the ladies' room. You will use the right rear door and then make an immediate left. For the men's room, it's the left rear door and also make an immediate left. If you are on Twitter, please follow us at American Health. And please do subscribe and listen to us at American Health Podcast. Today's agenda will be found in your packets. There's a speaker's bio as well, a notepad and an evaluation form. There's also a flyer about the Bloomberg Fellowship Program. And when fully implemented, we will have 50 MPH students as well as 10 DRPH students each year. And so we're excited about that. For the second year in a row, life expectancy in the US has declined. To address this decline, Bloomberg Philanthropies gave us a transformative gift to tackle 5 areas that are not traditionally seen as public health areas. Those areas include addiction and overdose, adolescent health, violence, obesity in the food system, and environmental challenges. Rooted in communities across the country and through a 3-pronged approach of research, professorship, and education, this transformative gift allows us to train future public health leaders from community organizations, the private sector, and from public agencies, to equip them really with research and public health tools to then go back into their communities and do the work with partner organizations to make immediate and impactful differences. We currently have 8 Bloomberg Fellows in our inaugural class, 2 of whom are focused on environmental challenges. We have Kelly McIntyre, and I'll ask her to stand in just a moment, but Kelly works with the Philadelphia Department of Health. She uses her background in fitness and wellness programs to inform her work as the physical activities coordinator for Get Healthy Philly, a division of chronic disease prevention at the health department there in Philadelphia. Kelly's work includes working with communities to promote healthy physical activity and to promote the built environment to support improved health. Julian Drix is also our fellow in environmental challenges, and Julian is with us as well today. He's the asthma program manager for the Rhode Island Department of Health, where he develops, implements, and evaluates programs intended to address asthma in the state. Julian focuses on environmental justice and environmental impacts for low-income and marginalized communities. I would ask them both to stand. So this morning, the team and I are in the back of the room, and we would be happy and pleased to share more information about the Bloomberg Fellowship Program and who are change agents in each of your organizations that would benefit from being a Bloomberg Fellow. And certainly you can talk to Kelly or Julian at any time about their experience as a Bloomberg Fellow. So we know that environmental challenges is a broad issue, encompassing air pollution, the built environment, transportation, climate change, water, so many others. We also know that we are all impacted by the environment. We understand that there are community, local, state, and federal level approaches to addressing environmental challenges. And we understand the complexity of this issue. We know that it's broad. And so today you are here to help us address this challenge, not just to have robust discussions, right? You are here to be active participants, to help us understand how to really truly move the needle in this area. Each of you were invited with the express intent to help us move forward, help us identify the research, the education, and the practice priorities that are relevant and impactful to addressing environmental challenges. And I say that because this was not an open conference. This was an invitation only. And it was invitation only because we know that you are the folks who can help us really think about this issue. How do we really address it from a policy lever, from the data perspective, and help us also talk about and identify the gaps within this area. So today we're going to be informed by the experts, by each of you, the data, the evidence, and the innovation. So again, thank you for really honoring our invitation and being here. I would like to note that we're also challenged by so many other things, but we're going to be challenged by time. So while the issue of environmental challenges is broad and huge, our time is also going to be challenged. And so please do not ignore the timekeeper who is right here. And if you choose to, we have a large red lead timer in the back that will go off. And no one wants that to go off, but we do have it in the back. Thanks, Dory, for pointing it out. So before I introduce our focus leaders, I want to recognize our Dean and Fearless Leader, Dr. Ellen McKenzie. Yes, Fearless Leader. The Director of the Bloomberg American Health Initiative and the Vice Dean of Practice and Training, Dr. Josh Sharfstein, who will be with us a little later this morning. Dr. Al Summer, who is not here, but one of our biggest champions of the American Health Initiative and distinguished professor. Also, Jessica Layton from Bloomberg Philanthropies, who is a force and a champion behind the work that we do, and we thank her for her support. And I also want to recognize our team, Akola, Faria, and Dory, and certainly Katie for the tireless efforts that they have done in trying to help us put this together. And certainly Dr. Burke for all he's done. Now it's my great privilege to introduce Professor and Chair of the Department of Environmental Health and Engineering here at Johns Hopkins, Dr. Marcia Wills-Karp. Dr. Karp's research activities focus on defining the environmental and genetic determinants of allergic airway diseases such as asthma. More recently, she has turned her attention to how exposure to air pollution during pregnancy impacts birth outcomes and subsequent development of chronic diseases such as asthma and obesity. We'll also hear later from Dr. Kirsten Kohler, an associate professor in environmental health sciences, and Dr. Megan Latchar, both of whom are co-leaders for the Environmental Challenges Work Group. So please join me in welcoming Dr. Marcia Wills-Karp.
Thank you, Michelle, and welcome to everyone. I'm delighted to see all of you here. We're very appreciative of the time that you've taken from your busy schedules to be here, and we hope this is going to be a very inspiring and informative day. But first, I'd like to give a big thanks to the former Mayor Michael Bloomberg for his vision, leadership, and commitment to the health of the American public. By establishing this initiative here at Johns Hopkins. Also, thank you to Josh Sharfstein and Michelle for their leadership of the initiative. And thank you to our environmental challenges team, Megan, Kirsten Kohler, and Tom, and Katie for the concepts behind this initiative that we're going to share with you today, and developing all the logistics for you to be here today. So we are here today to explore ways to mitigate the effects of environment on public health. And as we know, and Michelle mentioned, there are numerous environmental influences on health. So we have tried to, with our internal work group, to narrow this down, at least initially, so that we can make some real impact. So we focused our efforts on 4 complementary themes. The first is energy and health in a changing environment. Using the best available science, we considered developing models of health impacts related to energy choices. And we want models that can help guide local and national policy around energy. Secondly, it's transportation, and also in a changing environment. We want to explore how innovative transportation systems can mitigate environmental risk and improve public health. Thirdly, community design. And by this we mean the design of cities and the planning that goes into designing cities. So working with communities and city planners, we hope to better incorporate environmental health into community design, considering healthy housing, sustainable infrastructure, and resilience, particularly to extreme weather events. And the last is air pollution. This relates directly to the other 3 areas and offers an opportunity to characterize sources of air pollution and maybe change exposures to air pollution and adopt policies to mitigate these effects on public health. So even though we say that we are focusing on these areas, we don't want you to feel inhibited about speaking about other issues of the environment. And we'll certainly encourage you to bring up related topics. But ultimately, we hope that this will lead to new policy options for reducing the long-term effects on public health. And while, in fact, we encourage you to go beyond our themes today and think about how this works in a broader system. After this meeting, we envision setting priorities for education, research, practice, and communication in order to transform environmental health, both locally, regionally, and nationally. And we want your guidance as stakeholders and experts to inform our decisions around these efforts in both education, research, and policy. And we're hoping that there'll be a lively exchange of ideas, and we'll get insights from this really extraordinary group of people here today so that we can develop a plan of action for tackling these 4 areas. And we thank you again for your participation. I know some of you have had to travel from afar to be here and take time out of your busy schedules. And so we're very appreciative of your time, and we hope that this is a stimulating and exciting day for you as well. So thank you very much. So our next, sorry about this, program notes didn't tell me I needed to introduce Tom, but I don't think Tom really needs much of an introduction here. But we're very happy to have Tom back with us.
Yes.
Okay.
That'd be great. Thank you for being here. This is a wonderful opportunity for us during these very challenging times to, in a lot of ways, get the band back together and think. And so I want to thank folks. And I changed the title of this talk last night. You see in the program it says a vision. And I don't consider myself the vision person, but I am kind of a sponge, and I have learned from pretty much everyone in this room during various stages of my work. And so what I'm talking about here will seem familiar to some of you, real familiar to some of you who've co-authored some of the papers, and hopefully will chart a path forward for us. But I wanted to start out by some shout-outs. Now, first of all, I already mentioned Gina McCarthy, and Gina gave me the opportunity to work for President Obama. And I'm not going to go too political, but I am going to rant a little bit in the few slides up front. In my many, many interviews and vetting, and the final interview was with Gina McCarthy, and you get to ask a question of the interviewer, too. And so I said, well, why do you want a public health professor? And her answer was great. She said, environmental protection is public health. And I want you to help me let people understand just how important environmental protection is to their health. And it was amazing. She also, those of you who work for the government know there's this saying that I really haven't heard too much, even in state government, but down in Washington it's prominent, and the saying goes like this: stay in your lane. All right? Please don't stay in your lane during this meeting. One great thing about Gina was I don't think she ever heard that saying, and working with her was a complete joy. Now, there's another picture there, and you might see an earlier photo. About 19 years ago, or maybe 18, we had the Pew Environmental Health Summit that really laid the groundwork for environmental public health tracking here at Hopkins in Baltimore. And I just wanted to give a shout out to Suzanne Condon and Dick Jackson and many of the folks from state and federal agencies that were a part of that. I just wanted to remind us that we can, when we put our heads together, transform the practice of environmental public health. And then finally, the picture up top is one of a get-together at the Office of Research and Development probably about 2 years ago. And I wanted to give a shout out to particularly the younger scientists in EPA. And my colleagues here today from EPA, I want you to know we're with you. The public health community stands behind the role of EPA, which I believe really is the protection of public health. And today I think we'll have to take a look across the different ways of thinking about environmental health. Because no doubt, times have changed. Just think back a couple of years. I'm going to talk about climate change because it's the big one, it's the elephant in the room, and it is a huge public health issue. But not too long ago, we had a leader who said, "I refuse to condemn your generation and future generations to a planet that's beyond fixing." Well, flash forward to the Rose Garden in last June. As of today, the United States will cease all implementation of the non-binding Paris Accord and the draconian financial and economic burdens the agreement imposes on our country. There you have it. These are my rant slides. I'll get through them quickly. Are we moving backwards? The challenges particularly to public health with the Paris Agreement, the Clean Power Plan, the waters of the U.S., the Toxic Substances Control Act, the challenges on risk assessment, the backward motion on pesticides. Now we see the Science Advisory Board changed. One of the things near and dear to many of us is the research cuts that are proposed and being implemented in the Office of Research and Development. And most recently, the limitations on the use of scientific evidence for public health decision-making really indicate the kinds of challenges we face today. But I ask you, were the old ways of doing things all that great? Don't we really have a chance now to rethink, seeing these great challenges? And so I want this meeting to be optimistic in that we have an opportunity. Clearly things are changing, but can we help guide this? And were the old ways all that great? And to remind you that actually, no, they weren't, I want to go back to 1988 and actually a landmark report from the National Academy, the Institute of Medicine, that talked about the removal of Environmental Health Authority from public health agencies. Back there on Earth Day, a lot of things changed with the formation of the Environmental Protection Agency. And the IOM found that this led to fragmentation of responsibility, a lack of coordination, and inadequate attention to the health dimensions of environmental problems. And in fact, any of us who have worked in various lanes know that this is a paper we worked on here, which really was influential in getting the Pew Commission started, that looked at the silos of our national approaches to environmental health and environmental protection. And there you see, from the very top, down through the federal agencies, the various lanes, the various compartments, and the many agencies from transportation to energy to defense, to the big one in the middle, EPA. But even within EPA, it's striking how pesticides and water and land and the various compartments of environment are really separate. So thinking about this in a context of being optimistic for today and thinking toward the future, I know this is an old movie, but it's a pretty cool one. Jeff Bridges did a great movie, I think even before The Big Lebowski, Starman. And he's an alien from another planet, and they ask, and he's talking about how tremendous human beings are. And he said, "You're at your best when things are worst." And now, I'm not saying we've hit bottom yet on thinking about environmental health, but let's face it, these are challenging times. And the nature of our problems are changing. So I had a commute that looked something like this today down in the JFX, but I had to get up really early to make sure I got here on time because although we may not have all the lanes of traffic of Los Angeles, we certainly share in most of our communities real challenges of transportation, energy, and the problems of environmental protection, environmental health. Really, although we have the compartments set up, are changing. You can't think of a single compartment that thinks about food production, air quality, transportation, land use. And so in evaluating these, I turned back to the Academy and another National Academy panel that I had a chance to be a part of that really defined today's environmental problems. as wicked problems. The challenges that we face today in environmental health are complex. They have many interacting factors. They have various spatial scales and temporal scales. Many have global implications and are difficult to define. They're socially complex. And let's face it, no one solution. And most importantly for us, particularly in the academic community, is they extend well beyond the understanding of any single discipline. And so the findings of that report, which were focused on the Environmental Protection Agency, but were really important for all of us, were that environmental problems are increasingly interconnected, and we can't any longer can we address problems one at a time. Let's face it, as we argue the health effects of single pesticides and perhaps lose the focus on the broader food system and agriculture and the broader impacts on the environment, we're really not being effective. So we can no longer address one hazard at a time without considering how that problem interacts with and is influenced by other influences of the environment. So the committee recommended that we substantially enhance the integration of systems thinking into our work, and we enhance the capacity to apply systems thinking to all ways that we approach these complex problems. So that was actually a committee that I served on while I was, some of you may remember, I was in limbo for quite some time in the Senate confirmation process. So to spend some time, I really focused on the science over at the Academy. But now I'd like to share with you some reflections from my postdoc at EPA, a couple years down there on the front lines. The problems were, in fact, wicked problems. From the fires, the wildfires, to the energy choices and the challenge of fracking, to Flint, Michigan, to the loss of Toledo's drinking water supply from an algal bloom, and then the interconnectivity of the western waterways that the Gold King mine demonstrated so graphically. There were many challenges, and they continue to be challenges which face this nation, from the health impacts of climate change and the related extreme weather events, from the public health issues related to our response to the climate challenge, to energy, food and agriculture, and then, of course, we still have those specific issues. And it's very interesting. Even though they may focus on a single pollutant, just pick one, say mercury, and try to think, well, there's a single solution to that, right? Well, not really. The solution shouldn't be the end of the process where you're advising young women and women of childbearing age about consumption of contaminated seafood. We should think of the system and think of opportunities for public health progress in the system. And so I wanted to just bring a couple of examples home, because probably one of the most challenging things I've ever been a part of in my life was completing a major study of the impact of hydraulic fracturing on the nation's drinking water resources. When I got to EPA, finally, after that long road through confirmation, fits and starts, and I sat down there my first day, January 12th of 2015, I met with Gina McCarthy, and I said, so what do you want me to focus on? And, you know, I was hoping for that public health message again. She said, fracking. I'm like, okay. So the EPA, the Office of Research and Development, and the entire agency really worked on a systems approach to look at the broad impacts of fracking. Again, thinking systems, and I know you're thinking, well, why are you just looking at water? Well, you're right, but we did take a systems approach, looking at the water cycle from the getting water for the fracking operations, through the chemical mixing, through injection, through the drilling process, and ultimately through disposal, looking at the entire stepwise system of fracking. And the amazing thing was, it was truly a systems approach with over 300 scientists and engineers. From the start, a dedicated communications staff. From hydrologists to toxicologists, modelers, and field ecologists, and even epidemiologists. And if you're taking a look at those impacts and the many compounds where we have so little information on human health effects, we also had to use new science of computational toxicology to try and understand potential toxicity. So it was an example within the water realm, the water system, of a real systems approach that had very important findings that I think still remain controversial, but clearly major mechanisms by which we do hydraulic fracturing can have impacted the quality and quantity of drinking water. And we spelled that out. There were major reportings of the findings. And the report said, finally, after tens of thousands and really unknown numbers of wells throughout the United States, that fracking can affect the quality of drinking water in the future. Now, at the same time, this was released just as transition was happening, and there were concerns, particularly by the environmental community, about how the new administration would really think about the regulation of oil and gas exploration. But I wanted to end with thinking, well, this was an example of a success within one component of a system, but clearly there are unanswered questions about air, transportation. Going to some of those fracking sites, you could see in rural Arkansas, those roads were never meant for the movement of those heavy equipment, those tanker trucks of waste, and for the impacts on those very small communities, not just their well water, but the bigger picture of exposures and health impacts. And then, of course, the climate connection to fossil fuels and the long-term implications of oil and gas energy domination. And then another big one, and I'm glad to see Pat Bricey here, because we were, in many ways, joined at the hip on Flint. Flint is a systems failure. We all know the story of Flint. We've had speakers here talking about it, but Flint, although primarily seen as a drinking water quality issue, from the change of water sources to the Flint River, to the design of the drinking water system, overbuilt. Thinking of the population changes in Baltimore, you must be really aware from the lessons of Flint of an overbuilt system and the challenges of decaying infrastructure, the disinfection challenges of keeping that water safe, and really the true tragedy of Flint, in addition to the lead exposures, was the Legionella, the microbial risks, the day-to-day challenge. And most of our days began, Pat and I on the phone, Pat saying, what's the chlorine level? How's the residual chlorine out in the system? Because we were worried about immediate effects of infectious disease, in addition to chemical risks and of course, lead. And so many folks have really pushed in Flint for the replacement of lead service lines. And I think this is a telling photograph there. You see progress, a commitment to replacing lead service lines throughout the system. But right there across the street, if you take a look at that blue house and the paint on that blue house, those of us in environmental health know that lead is a clear example of the need for a systems approach. And eventually, and there's Pat in a crowded war room of folks who were there on scene at Flint with Gina McCarthy, really ultimately, unfortunately, after so much had gone on for so long, responded in a way that brought together virtually all the agencies of public health on the federal level, on the state level, and with, unfortunately, very limited local capacity, really began to develop a public health response that addressed everything from education to health care to medical screening to the water. So environmental health is way beyond one compartment. And this is one nice model of the need to think from a systems perspective. There you see our target audience, the people in communities, and the things that address and influence health of people. But we have lifestyle, we have community aspects, local economy, we have the activities within that community, we have the built environment, the natural environment of a community, and in the broader perspective, the impact of the global environment. There are many determinants of population health. So as we look to the future, what do we need to solve the environmental challenges of today? Well, first of all, we need to get the problem formulation right. I think we need systems approaches and tools. We need to draw on new technologies and novel techniques, and I want to talk a little bit about them. I also want to mention that this meeting is part of an effort I think that is resonating within the environmental community. As I mentioned at the start, this is a tough time for environmental health, and the scientific community is very aware of the challenges that we face. And so I'm happy, and we have Marilee Shelton here today from the National Academy to chair a new initiative down at the National Academy, which was just announced a couple of weeks ago, an academies-wide initiative to transform how the nation addresses environmental health, bringing together expertise across the institution, the many boards of the National Academy, environmental, medical, social science, energy and engineering, to involve the leaders of government, business, and academia to explore the latest science to improve environmental health. Because environmental health is poised to take advantage of many, many new tools. As we face these great challenges, it's also a time of incredible innovation on the scientific side, on the analytical side. But we need to embrace the disciplines well beyond traditional fields. Real progress in changing our environment and impacting public health will require coordination across the disciplinary communities in multiple sectors that haven't really been part of environmental solutions. So what will we require here? What will we be thinking about today? What is our mission today? Well, just from the folks in this room, we see an integration of disciplines across the scientific disciplines, across the various agencies and responsibilities that we represent. Hopefully, we will develop new partnerships. We'll redefine the approach to science. It will be based upon information and data presentation in a new way, much like Michael Bloomberg has led the way in other fields, informed decision-making based upon strong science and great information. And then we have that education and communication challenge. One tool that you'll hear about today, which is particularly important, is health impact assessment. Now, health impact assessment is dependent upon information. In a lot of ways, environmental public health tracking was important to set the foundation for the implementation of health impact assessment. It's a systems approach to array data sources and analytical methods, consider input from stakeholders, and determine the potential effects of a proposed action on the health of a community. And I imagined, as I sat there in so many meetings on Flint, if only someone had thought about this when that decision to switch from the Detroit water supply to the Flint River had been made. Obviously a major decision for a community. Was anybody looking upstream? Was anybody thinking about the power of a health impact assessment? But then as I thought through it, it's more than just Flint. Wouldn't it be great if there were tools for our local practitioners, our frontline public health officers in communities, perhaps communities that are impacted by operations like hydraulic fracturing, so that they look upstream, they can see the impacts of these policies, particularly on human health. And also want to think about education, because as we work toward really transforming the field, we have to take a hard look at academia and say, are we doing the right thing here? Are we training the future leaders in the right way? And so I was struck recently, I visited a very prominent environmental science program doing a site review, and an anonymous, very famous professor said to me, the students don't want to learn the science. They want to study things like food. What? Obesity, community planning. They want to use GIS. They're interested in communication. This was a tremendous, a mentor of mine from another university, not here, but who was really saying, well, the old ways, the dependence upon toxicology, microbiology, the laboratory science are changing. And we need to see those interconnections. We will still need that strong scientific foundation, but let's face it, the students have it right. They're preparing to face those wicked problems. So the Bloomberg American Health Initiative gives us a great opportunity today. There's not a lot of opportunities to get this kind of brain power in one room and think, particularly during these tough times. So we have a chance to do some interdisciplinary thinking today and problem solving, to think about how we collect data and strengthen the interpretation of community and communication of data, and really strengthen that public health environment connection. The ultimate goal is to develop vision. So for my last slide, I just want to throw some things out today. We will have a very interactive sessions, and we will be looking through the lens of specific challenges. But at the core of this is thinking about a systems approach. So what do we really want to do here? Well, let's think big. Transform education, research, and the practice of environmental health based upon an inclusive systems approach to problem solving. From the Bloomberg perspective, Michael is very, very demanding, and he wants to see action, usable tools. So the second one, to equip frontline practitioners with new data tools for tracking environment and health indicators, identifying vulnerable populations, and addressing these wicked problems. Perhaps to shift the strategies away from pollution permitting, single pollutants, to thinking about the design of healthy, sustainable environments in communities. To expand the range of science and expertise through cross-disciplinary teams, to consider the interaction between environmental conditions and health. And here's a challenging one for many folks, to engage the business community in seeking a better balance between the burdens of regulation and the benefits of a healthy environment. To develop the data resources that environmental health decision makers need, including, and I really want to underline this, social data, economic data, as well as health and environmental indicators. To harness the emerging power of citizen science, the new apps and social networks, to increase public involvement and endorse that. To include involving technologies, including personal monitoring and sensors, to complement the existing monitoring. Lots of people are really nervous about these sensors and the individual monitors that are changing the way we understand the environment. We need to endorse that and understand that there's this incredible complementary possibility here to understand the environment. And then it comes down to, how did we get here? How did we get here on climate? How did we get here on let's face it, the deregulation that we're witnessing in environmental health being something that's seen as a tremendous accomplishment rather than a tremendous threat to public health. So we need to enhance public understanding and trust in environmental science. How do you do that? Well, you have to provide useful information that's responsive to communities, to promote interdisciplinary environmental health research, and be responsive to the needs of community decision makers. And then finally, to take a hard look at our curricula. Are we training folks to examine the educational programs in environmental health and the other sciences to develop the curriculum for the future? So I'm going to stop there. And what I've put out is a pretty bold challenge, I think. But I've done this from listening to so many folks in this room, being part of the practice community, part of the academic community. And I think today we have an enormous opportunity through the lens of the specific issues that we'll be discussing. I think we can get there. So let's get to work. Thanks.
Thank you, Tom. And thanks to Michelle and Marcia as well for setting the stage for us today. I'm Meg Perry, a facilitator with Resolve just down the road in DC. And it's my privilege today to be the person who keeps track of some of the needs in this room as you all think about needs and challenges outside this room. And so I'm just going to walk through a few kind of miscellaneous logistical things for you and introduce you to the agenda that you should have in your folder on the left-hand side. So just a couple of reminders. Restrooms for ladies are out this back door here to the left, for gentlemen out the other door also to the left. If you can, please turn your cell phones to a silent or a quieter mode so we can keep the focus in the room. We do have a couple of handheld mics on either side of the room, and Josiah and I will be running those around to you during discussion so that we can capture the discussion on the recording that's being made, and so you all can hear one another. Another reminder, just thinking about the great collection of types of expertise that we have in the room today, I'd encourage everyone to try to be mindful of jargon and acronyms and spell those out wherever you can so folks can follow along. And we do have Vicki keeping track of time for us today, so thank you. So looking at your agenda, we're now in our Welcome and Vision session, some great framing comments from Tom, Michelle, and Marcia to start us off. And we're about to move into a panel on data at the intersection of environment and health, so getting that data-oriented framing for the day. And we'll have a short break at 10:30, another chance to grab some food, get some coffee, stand up and stretch. And then you'll have the chance in small groups to discuss around some of those key themes that Marcia mentioned. So frontline health, planning, transportation, air pollution, and energy. So you should have a dot on your name tag, and that will guide you to your group. So I'll explain that in a bit more detail when we get there. At 11:45, there will be lunch available, so you'll pick that up and come back to your tables. And then you'll hear at 12:15 from Jerry Taylor on communicating evidence to policymakers. And communication has been a theme that's come up a lot in the planning of this, and thinking about how all of the good thinking that you'll do today gets translated out into the world and can actually be implemented and understood. 1:15, we'll have another panel, Public Health Tools for Decision Making, and this is particularly focused on looking at examples where specific tools have been used and been successful, so get a chance to hear from some folks who are using these innovative tools and discuss how those work in the real world. A short break at 2:15, and then Megan will report out on what happened during those roundtable discussions. So we've given her a little time to process the outcomes from those discussions, but you will hear back some key themes around each of those issues that arose in your small discussions. And then 2:45, a panel on innovations for transforming environmental health. And this, again, is focused around some of those key issues: planning, transportation, energy, and air quality. And then finally, we'll close during the 3:45 session thinking about a systems approach to healthy communities from Megan, and adjourn at 4 o'clock. And then there's a reception following, and dinner with Pat Bricey speaking as you eat. So some good thinking to happen over dinner. Any questions or anything from the planning team that I missed as I was running through the agenda? Okay, so I just encourage you all to dive in. Much good discussion, much learning to happen today. And do keep in mind that this room is part of the environment. You are part of public health, so take care of yourselves today and do what you need to do to be fully present in the room. All right. So with that, let's then turn to our first panel, and I'll turn it over to Kirsten to open that up.
Good morning, I'm Kirsten Kohler, and I'm pleased to be moderating our first panel this morning, Data at the Intersection of Environmental Health. So I'd like to invite up our three panelists this morning who are going to help us frame this topic from three different perspectives, from the global, national, and local lens. So if we could have Drs. Howie Frumkin, Jennifer Ormzal-Valletta, and Gina Solomon come up and join me. Thank you. We'll start with Dr. Howie Frumkin giving us a global lens for the data discussion today and help us think about what's known and get us working toward what are the most important things coming up next. I don't know how to change the slides. But before we get started, Dr. Frumkin is an internist, occupational and environmental medicine specialist, and epidemiologist. In May, he'll begin as the head of the Our Planet? Misspelled on here, sorry. Our Planet, Our Health Initiative at the Wellcome Trust in London, the largest source of research support at the interface of human health, climate change, urbanization, and the food systems. Before that, he's been the last 8 years a professor of environmental and occupational health sciences at the University of Washington School of Public Health, for 6 of those years as the dean. And his research interests include public health aspects of the built environment, climate change, energy policy, nature contract, and sustainability. Thank you for being here today.
Well, good morning, everybody. Kirsten, thank you. Tom, Megan, thank you for this great gathering. It's an honor to be here. Okay, well, I'm going to jump right in and begin with a little history. I'll begin at the global scale, and then we'll move through other scales. The global changes that have so much to do with environmental health originate here, with the epical changes in the way we humans use energy, beginning about 2 centuries ago. Human exploitation of energy has skyrocketed in what is historically the blink of an eye. As you can see here, almost all the increase in energy use in the 19th and 20th centuries came from fossil fuels, coal, oil, and gas. All that energy and all the materials that the energy allowed us to harvest and use led to a massive scale-up of human activity, as you see here. Population, economic activity, dam construction, fertilizer use, paper manufacturing, travel, you name it. This has been called the Great Acceleration. The Great Acceleration has had a heavy planetary footprint. We appropriate about 40% of the ice-free, desert-free terrestrial surface for pastures and croplands, and about half the planet's accessible water. We exploit 90% of global fisheries at or beyond their maximum sustainable limits. We've dammed over 60% of the world's rivers and cut down between 7 and 11 million square kilometers of the world's forests, an area somewhere between that of Australia and the US. The quality of air, water, and land is diminishing in many parts of the world because of loading with pollutants. Carbon dioxide and methane levels in the atmosphere are rising. Ocean pH is falling. These and other processes are driving species extinct at roughly 1,000 times baseline rates. These are substantial perturbations of the biosphere. The biosphere, that, to put it in context, is roughly as thick in proportion as a layer of cellophane stretched over a soccer ball. This iconic image represents a safe operating space for humanity. The idea that there are limits that, if transgressed, may threaten not only Earth systems, not only human health and well-being, but the very basis of civilization. You'll notice climate change up at 12 o'clock and land use change at 9 o'clock, both represented as being in a zone of increasing risk. You can see biodiversity at 10 o'clock divided into genetic diversity in the red zone and functional diversity. You can see environmental loading with chemicals at 2 o'clock and with aerosols at 4 o'clock with question marks because we can't yet say exactly what the limits are. There is active debate around this image, the idea of specific boundaries rather than continuous variables, the interplay between global and regional trends, and so on. But it powerfully conveys the notion that we need to live within limits. Ironically, despite all this disruption, human health is better than it's ever been. Life expectancy is longer, infant mortality and rates of many diseases are lower than at any time in human history. But we've achieved these gains through the same unsustainable use of energy and resources that propelled the Great Acceleration and destabilized the planet. In the words of the Rockefeller Lancet Commission, we have been mortgaging the health of future generations to realize economic and development gains in the present. The core proposition of planetary health is that these global changes are driving an increasing burden of human disease and threatening to undo the public health gains of the last century. Let me cite 4 examples before I turn to the question of data. First is climate change, perhaps the best recognized of the planetary changes that affect human health, operating through many pathways. Some are primary and direct, such as those due to heat and severe weather events in the red box at the center. Earth system changes lead to secondary effects, such as infectious disease risks. You can see those in the purple boxes at the bottom. Tertiary effects, such as armed conflict and population displacement, are mediated by more diffuse and complex social disruptions in the green area to the right. Of course, these categories overlap considerably. Every important kind of human suffering is affected: infectious diseases, NCDs, traumatic injuries, mental distress, and disease. A second example is the widespread dissemination of synthetic chemicals through Earth systems. Plastics, the polymers of simple molecules such as ethylene, propylene, and styrene, are well recognized, perhaps because they're so visible. Plastic production began after World War II and has now reached 300 million metric tons per year, or about 40 kilograms for each man, woman, and child on Earth. These molecules are persistent. Plastic waste enters waterways and goes global, entrained by the world's 5 great ocean gyres. I screwed up slides here. It's been found in the deepest ocean trenches, in Arctic ice, in Mongolian mountain lakes, on remote island shores. Animals ingest the plastic. An estimated 90% of seabirds now have plastic in their bodies. In one recent study, fish and shellfish from markets in Indonesia and California were assessed for plastic debris. There it was, in a quarter of individual fish and well over half the species sampled in both countries. When we eat fish, we are eating plastic, along with the plasticizers, flame retardants, and other additives that comprise about 7% of plastic, and the organic chemicals that efficiently adsorb to plastic surfaces. Synthetic organic chemicals mirror plastics in their production history, but are less visible. Many of these chemicals persist in the environment, the so-called persistent organic pollutants, or POPs, and spread widely through atmospheric and oceanic transport, as pictured here. They're fat-soluble, so they bioconcentrate within the fat of organisms, such as fish and cattle. They're biomagnified as they move from lower to higher trophic levels of food webs. POPs are now globally distributed, even in ecosystems such as the Arctic, far from where they were ever produced or used. With POPs so widely distributed, human exposure is unavoidable. Population sampling now shows nearly ubiquitous body burdens in human populations. Many of these chemicals act as endocrine disruptors and are implicated in diabetes, obesity, and lipid abnormalities, non-Hodgkin's lymphoma, cancers of the breast, ovaries, and prostate, thyroid disease, neurobehavioral disorders, reproductive dysfunction. One recent study of Inuit people in the Arctic found that those with the highest blood levels of PCBs were 1.9 to 3.5 times more likely to have diabetes than those with the lowest levels. Chemical contaminants are a planetary problem with real human health consequences. A third example of global change with human impacts is freshwater hydrology. This graph shows the dramatic increase in dam construction around the world. The Columbia River Basin, where I live, is fully built out. But in other areas, dam construction has only just begun. For example, this image of one river basin in northern India shows 6 existing dams in green, 7 dams under construction in brown, and no fewer than 24 dams in planning stages. Similar dam building sprees are underway in the Amazon basin in China and elsewhere. Now, of course, this isn't all bad. We need to be systems thinkers, as Tom reminded us. Energy poverty is a bad predicament. Reliable energy is a pillar of health and prosperity, and hydro is a relatively clean energy source. But dams come at a cost. River ecosystems are altered, species composition changes, fish populations can be seriously compromised. Major dam projects can displace populations, as exemplified by the Three Gorges Dam shown here, with attendant risks ranging from infectious disease to depression and anxiety. Changing conditions along rivers can raise the local risk of malaria, schistosomiasis, and other infectious diseases, and even drive the formation of toxic materials such as methylmercury. Many of these risks can be managed, but it's clear that we're changing river systems on a planetary scale and that human health can be affected. We've altered not just surface water, but also groundwater. Of the world's 37 largest aquifers, human withdrawals have depleted 21 beyond their tipping points. This cartoon shows the High Plains water system, principally the Ogallala Aquifer. This map shows water level changes in the aquifer over the past half century. Levels have dropped dramatically, especially in the southern portion of the system. The red and pink areas you see there indicate declines of over 100 feet. Dry wells aggravate long-standing outmigration from rural areas in the Great Plains. In combination with the stresses of climate change, they also likely portend substantial changes in food production patterns. These directly and indirectly affect people's health and well-being. My fourth and final example of global environmental change is biodiversity loss. Consider pollinators. Pollination by insects is an important form of reproduction for more than 35% of annual global food production by volume. At least 87 major food crops and up to 40% of the world's supply of some micronutrients, such as vitamin A, depend on pollination by insects. Pollinators are declining in many parts of the world, probably for a combination of reasons, including habitat loss, pesticide use, and parasitic infestation. Pollinator loss can reduce the amount of fruits, vegetables, nuts, and seeds in the diet, contributing to vitamin A and folate deficiencies. These 4 examples, climate change, chemical loading, disrupted freshwater hydrology, and biodiversity loss, are drawn from a larger group of such planetary changes with far-reaching impacts on human health and well-being. Clearly, the future of environmental health needs to reckon with these planetary changes. I'll close with 4 comments about data. First, we need traditional health, demographic, and disease risk factor data, but we need more. We need data on equity and other global social processes and outcomes such as migration. But we need more. Our data collection needs to extend to the planet we inhabit. Carbon dioxide levels, data on oceans and rivers, on the atmosphere, fisheries, forests, and much more. And we need to combine all these using modern data analytics to understand complex systems phenomena that affect health and well-being and to track progress. Second, we need data not only about the past and the present, but about the future. Intrinsic to planetary health is the fact that profound changes are emerging. We can't predict them, but we need to try. People are suffering today from direct and indirect effects of climate change, but many more impacts will emerge in coming years. So we need, to the best of our ability, to forecast future occurrences. We need to look not only at trends, but at possible tipping points and sudden system changes. Predictive models are key. And by the way, these projections rely heavily on the data streams I just mentioned. Third, we need to transform data into information, and information into what really moves people, stories and narratives. Here's a photo of people sitting around a campfire, engaging in one of the oldest human rituals, telling stories. I don't know what stories they're telling, but this I know. None of the stories features data-dense PowerPoint slides. But something about the place, the companionship, the caress of the evening air, the sounds and smells of the fire will make these stories stick. We all acknowledge that we want data to drive policy. Fair enough. Of course, we often fail, in part because data are eclipsed by absolutely impregnable memes, belief systems, and narratives. And the global challenge is bigger than just changing people's thinking. We need to drive the transformation to a sustainable post-carbon economy. That's bigger than policy. That's culture change. Compelling stories and narratives will be key. So as we contemplate the future of environmental health, we need to think just as hard about data communication as about data. Here's the challenge. Just as readers read and speakers speak, numbers numb. That's what they do. That's why they're called numbers. And thanks to Ed Maybach, here's the second half of that aphorism. Stories stick. Numbers numb, stories stick. Let's go further. Numbers numb and complexity confuses, a challenge given the complexity of planetary changes and their impacts on us. But we can learn a lot from social marketing evidence. Numbers numb and stories stick, but pictures persist, simplicity soothes, repetition reinforces. The critical importance of communication, of course, is a concern for all of public health, not just environmental health. And it applies across spatial scales, not just at the global scale I'm discussing. But it's a special issue here, given everything we know from cognitive psychology and behavioral economics about how hard it is for people to grasp and act on long-term, large-scale trends. Fourth, to echo Tom, think of our students. If we're to collect and analyze health data, demographic data, Earth systems data, and more on a global scale, if we're to project current trends into the future to understand what's coming and how to prepare, if we're to communicate these insights effectively to change minds and drive policies, then we need to train the next generation to do these things. Traditional public health pedagogy will no longer do. Planetary awareness, big picture thinking, systems thinking, sustainability, multidisciplinarity, big data analytics need to be the pillars of our teaching in transforming environmental health. In summary, combined human and planetary data and data analytics, predictive models, effective communication of data through narrative, and requisite capacity building. I hope this global lens, when complemented by national and local lenses, helps focus our thinking on the environmental health challenges of tomorrow and on the data we need to meet those challenges. Thanks very much.
Thank you, Dr. Frumkin. We'll have time for questions for all of our speakers at the end of the session, so don't forget your questions. Next, I'd like to invite up Dr. Jennifer Orm-Zavaleta, who's the Principal Deputy Assistant Administrator for Science for the Office of Research and Development and the Science Advisor at the US EPA. She's been with the EPA since 1981, working in human health and ecological risk assessment, policy and regulation development, strategic planning, and program implementation. Her experience includes evaluating risk to human and ecosystem health and the influence of environmental change on human health in the response to a variety of stressors, including synthetic, organic, and inorganic chemicals, radionucleotides, microorganisms, and vector-borne diseases. Thank you for joining us this morning.
While I am standing up here, I also want to recognize some of the people that helped in pulling this information together. So Casey Diener in the back, and Megan Christian, and Valerie Zartarian, all with EPA. So there's a number of folks that have been thinking along these lines, and one in particular has been Tom Burke, who helped to re-energize some of the discussions that we've had. So many of the topics that I'm going to talk about are really kind of reinforcing things that you've heard from Tom, things that you've heard from Howie, that our thinking over time has been changing. So looking back to when EPA was first formed about 47 years ago, we were grappling with some very stark, very visible challenges. Things like tremendous landfills, piling up on top of the earth, slicks on rivers that were allowing those rivers to catch on fire, communities that were so contaminated that people could no longer live there. We've evolved in time, moving away from more command and control, human-centric, cancer-phobic kinds of thinking and looking at risk, to looking at newer challenges. We've made great improvements in our environment, but we're not off the hook. We still have a number of very complex or wicked kinds of challenges that you heard Tom speak about. Looking at new ways of extracting energy, looking at our where we're living and living in communities that weren't initially designed to support human populations, and looking at a lot of changes, as we heard about in our world, where excessive, lengthy droughts or 100-year floods that are happening every couple hundred years. And so as we looked at these newer, more complex kinds of problems, we do need to change our thinking in the way that we approach environmental protection and looking for more sustainable solutions. Not that we want to sustain these kinds of conditions, but we want to solve the problems. So with that takes some additional thinking and really figuring out, are there better ways that we can approach from the command and control approach to trying to solve these problems? Thinking and building on that risk paradigm, we need to do better in formulating our problems. We need to look at a systems approach and taking advantage of tools that are available there. Looking at new techniques, new technologies, such as high throughput screening and prioritization. We've got thousands and thousands of chemicals that are in commerce, and there is no way that any of us are going to be able to test every single thing. And so are there better ways that we can help prioritize those chemicals? Plus the fact that we need to think about real-world perspectives there, because if we regulate continuing on a single chemical-by-chemical approach, we're not going to make any progress towards protecting public health. So how can we look at these kinds of chemicals and new approaches, get a bigger bang for the buck in trying to protect public health? So this is going to take new frameworks as we evaluate health risks, as we look at ecological risks, taking into account life cycle assessment of some of these chemicals that come into commerce, and looking at health impact assessments. All of this builds on this idea of a systems approach. We've all heard it, everything's connected. And we're connected from the molecular level all the way through the biological levels of organization, up to population, community, and ecosystem. And there are new tools and approaches that help us and think through there, where it's high throughput screening, whether it's adverse outcome pathways, looking at in vitro assays to in vivo assays, individual risks, population risk, communities, and ecosystems. So really thinking a more holistic approach. And to do this, we need to be thinking through problem formulation in a better way, in a way that we're not just talking to like disciplines. We really need to bring in those variety of other perspectives. So bringing in the urban planners, bringing in even the attorneys, bringing in the economists and other social sciences, the vested partners, the end users, the people that are going to be dealing with the outcomes. Have that large interdisciplinary conversation that helps us to formulate the problems, to gather and synthesize a wide variety of types of information, thinking through what's going to be the potential outcomes, and then how do we solve the problems? How do we look to sustainable solutions? We need to monitor results. We need to be adaptive and build on what we learned to go back and improve and refine our problem formulation. So that requires a continual evaluation of the process. We also need to think a little bit differently about how we approach our characterization and evaluation of risk. Some of you may have learned in school, and some of you, fortunately, are younger enough that maybe you didn't have this, but I call it the old Nike swoop, where we're looking at source to outcome. That was fine for a beginning, but if we're really looking at trying to improve public health, we need to kind of reverse our approach on that and be more outcome-driven. So instead of looking at the starting point of a law or a particular source, we really need to look at, so what are we seeing out there? And this is where epidemiology is so critical. What are the kinds of outcomes and challenges that are facing our populations? And then do a little forensic work, working backwards to figure out what are the contributors. And it may not be any one single thing. It may be multifactorial. So we need to modify our thinking and really trying to improve that public health outcome. And to do this, we can take advantage of a variety of different kinds of tools. Building on this particular diagram, we're looking at a variety of approaches that improve individual health, but if we're really trying to maximize and get the largest impact for a larger population, community, or ecosystem, we need to be thinking about the tougher challenges. So looking at the base of this pyramid, looking at socioeconomic and environmental factors. These are the key, and focusing on these will help maximize the impact that we have on public health protection. Doing individual counseling and education That's kind of low-hanging fruit, and that's great, but it might help the individual level and not really get us to that larger population level types of impact. So what kinds of tools do we have available? Well, things like the air quality index and maybe sensors in some applications are helpful for that individual level type of protection. But there's other tools that will help us move down to the base of that pyramid and really maximize the impact that we have on public health protection. So things like health impact assessments, screening tools for environmental justice or community health, the Enviro Atlas, which I'll talk about here in a minute, Environmental Quality Index, as well as the Human Health Wellbeing Index. These are all the types of tools that EPA has been working on over the past several years. So the Enviro Atlas was designed initially to really look at ecological benefits. What are the goods and services that we value and want in our environment? But recognizing that everything is connected, this tool has really been a great integrator of looking at human health interactions and environmental interactions. So in this particular example, where we're looking at clean air as that valued ecosystem service, there's a couple of factors focusing on forests or on urban environments that will have impacts directly on clean air. But then you look at the benefits of clean air, and that feeds out into all of these other particular types of variables. So the idea here in looking for sustainable solutions is minimizing risk, maximizing benefits. So this tool is one that allows us to explore a variety of different scenarios, what-if types of scenarios that help us look at what we value and the best way of getting there. Health impact assessments is another approach that really facilitates this interdisciplinary kind of conversation, working directly with communities. And I know, Gina, this is stepping a little bit into your territory here, but the idea, again, is looking at communities and what they value, looking along the tenets of sustainability from the environment, society, and the economy. And if the focus is, gee, we're having too much flooding, or we're having nutrient issues, or we want to improve air quality, we want to have a better livable environment. How do we achieve those so that we really can maximize the kinds of health outcomes that can be benefiting from focusing on the health determinants? So this is a tool that enables a conversation between the end users, the end beneficiaries, and what they desire with people and the governance structures that can help them get there. Our thinking's also evolving in terms of how we're evaluating and how we're addressing these kinds of risks and concerns. And one novel approach that's evolved out of EPA for the past several years has been this approach called One Biosphere. And here, again, we're taking a look at the combination of social and natural variables within a system. And this particular example was focusing on nitrogen flow and how we understand nitrogen deposition from the air, and how it impacts or how it's used in land systems, and then where everything tends to end up is in the water. And so it evolved a coupling of a number of different types of modeling tools in order for us to understand the entire dynamics of the system. So here we are, 2018, and we're still talking about lead. We haven't solved the lead problem. Going on for decades and centuries, we're still finding issues with lead, still finding challenges where an estimate of over 250,000 children still have blood lead levels that exceed the CDC reference value. This issue became front and center again with the Flint situation we heard Tom talk about. And so part of it is how can we think differently about our understanding of lead? We all know it's toxic. We all know that there's really no safe level. It's difficult to mitigate. We can't remove it from the periodic chart. So what are the best ways that we can try to minimize our exposures to lead? And helping us and understand that, Valerie Zartarian and some other colleagues helped pull together a multimedia aggregate exposure modeling approach. Again, coupling different models that gives us a better sense of what kinds of exposures from different media will translate to blood lead concentrations, and then where might we better target controls and mitigation for lead exposures and then significantly impact and reduce those blood lead levels. So with Flint, the focus was on drinking water, but in looking through this particular analysis, We can't ignore soil and dust. And we are missing a lot of data on soil and dust ingestion, especially for infants. And so these kinds of modeling approaches are also very helpful in better targeting where do we need to collect data, but then also where do we need to really work on remediation of exposures and minimizing those exposures. So that was a legacy compound that's still around. And now we have a new challenge in looking at perfluorinated compounds. And so I'm continuing Tom's relationship with Pat Bricey, and he's now my new best friend in looking at some of these perfluorinated compounds, because this is a big issue that's more than any one agency. And we really need to work collectively together to understand, as we're looking at perfluorinated compounds, yes, we still have exposures to the legacy PFOA and PFAS, but we've got thousands and thousands and thousands of these shorter chain perfluorinated compounds that have been in commerce for about 20 years, are fairly ubiquitous at this point. And so we need to understand toxicity, we need to understand how to measure these things, how to monitor, we need to understand how to remove these from the environment, and how do we still achieve the benefits the consumer wants with stain resistance by different types of chemistry that are going to be minimizing the impact on the environment and public health. So again, this remains our current challenge. It's going to be a lot of work that, like I said, is more than any one agency. It's going to require all sectors in looking through in trying to address these particular issues. So just to close here, Tom mentioned, and I just want to reiterate, that as we think to the future and as we look in trying to seek sustainable solutions in solving some of these problems, we need to think outside the box. We need to employ all avenues available to us for collecting information, making use of citizen science. We're going to be grappling with big data and all the challenges that brings. How do we assure the quality of that data? How do we assure the availability of that data so that all of us have a chance to take a look at that? How do we get data that's real time? Can we take advantage of innovative technologies such as sensors? Looking at new ways of evaluating toxicity and exposure. And taking into account risks to vulnerable populations. So it really is going to require partnerships at all levels to leverage this information, to evaluate this information, and to seek sustainable solutions together. Thank you.
Thank you. And finally, to give us a more local perspective, I'd like to invite up Dr. Gina Solomon, who is a principal investigator at the Public Health Institute in Oakland, California. She researches policy activities to protect the public from chemicals that may contribute to breast cancer. She's also a clinical professor of medicine at the University of California in San Francisco, and has previously served as the Deputy Secretary for Science at the California EPA, and a senior scientist at the Natural Resources Defense Council. Her work has spanned a wide array of areas, including children's environmental health, reproductive toxicity, cumulative impacts, and using novel data streams to screen for chemicals and toxicity. Thank you for being here.
Good morning, everyone. I'm so happy to be here to join you for this really interesting conference. And my focus today is to try to bring things down a little bit more to the community level, to look at the situations that people live with day to day that have huge impacts on their health. And we've seen quite a few conceptual models, so I might as well add my own here, which sort of puts, this concept puts the person in the center throughout the life cycle, looking at the extrinsic and the intrinsic factors that interact with each other all across people's lives to either increase or decrease their health risks. And there are quite a few standard sort of pollution-related environmental factors, but those interact with dietary factors and psychosocial factors, and people have their own intrinsic resilience that increases or decreases over time as a result of what they're going through in their lives. And one of the things that you, of course, all know is that these kinds of cumulative impacts on people's health are not equitable across the globe or within communities or across communities. And what we've seen over and over again ever since the 1987 report, Toxic Waste and Race, from that looked at hazardous waste sites across the U.S. and discovered what many people already knew, which was that these sites are concentrated in low-income communities of color. There's now increasing evidence, in fact, very extensive scientific research from all across the United States in different communities has looked at this in the air quality realm, drinking water realm, and in terms of specific pollutants and the hazardous waste issue that we mentioned before. So we know that there are disparities, that those are linked to income and that they're linked to race. But the issue that we encountered and that we often sort of look at is, well, we kind of, environmental justice has been a term that's kind of you know it when you see it, but what about measuring it? Is there a way to measure environmental justice or environmental injustice? And if you can actually kind of measure all of those cumulative impacts, then it allows you to actually track them over time and do something about them. So what would a tool need to be? Well, participatory, allowing comparisons over time and space across communities, and at least semi-quantitative, if not fully quantitative. Oops, sorry, you're about to take a snapshot of that, but moving on to some of the different tools that there are, because I am under time pressure here. We took a look at this and kind of looked at some of the different tools that are out there and mapped them according to how quantitative versus qualitative they are and how, to what degree they include community engagement. And people might disagree with some of the mappings on here, but I think the point is that there are a variety of very useful approaches, and you sort of can pick and choose depending on what you actually need for a given purpose. Not that one is better than another and they all have limitations. But I want to focus a little bit on mapping because I think that it's a useful illustrative example, and it's something that we've been doing quite a lot of in California. And by we, I mean the California Environmental Protection Agency, where I worked up until just a couple months ago, and the Office of Environmental Health Hazard Assessment. I want to credit them for developing the Cal EnviroScreen. And the most recent version, version 3.0, was released about a year ago. And there will be a version 4.0 in about another year from now. So it's continually being changed and improved and updated. But the theory behind this was, okay, let's try to figure out where the communities are that are facing these cumulative impacts and cumulative burdens so that we can do something about them. And it was developed over many years with community meetings done in community centers in the evenings with a World Cafe type format around tables, showing people maps of their community, really getting a lot of input and discussing each potential indicator and how it would actually look in their community to get a sense of, does this ground truth? The tool uses census tracts as a scale. That ends up being a really good unit of measurement in urban areas. There are over 8,000 census tracts in California, and it's really they're very small in urban areas. In rural areas, it ends up being a pretty gross measure because of the lower populations in those areas. But it at least gives you a unit of measurement to work with. And there were four key components that were identified through a public process and an expert working group, looking at exposures, looking at what we called environmental effects, which are environmental conditions that degrade communities. You could argue about, there might or might not actually be exposure there, but they worsen the quality of life in the community. And then looking at sensitive populations and socioeconomic factors. And here are the exposure indicators that were included. And you could see that a lot of them have to do with air quality, but not all. But that is partly where the data exist. The problem being that you have to find indicators where you either have or can fairly reliably model them at a census tract level, and they cover the entire state in this case, but if you're looking at other geographic areas, you have to have that. And then the environmental effects indicators are things like nearby solid waste sites, even composting sites, which can have unpleasant odors and can certainly affect communities, and cleanup sites, groundwater threats, impaired nearby water bodies. And then we have 4 sensitive populations. Comes to how difficult it is actually to get good health data at a fine geographic scale, in part because of low numbers and confidentiality issues. So we have asthma emergency department visits, the cardiovascular disease indicators, really emergency department visits for acute myocardial infarction, and then low birth weight infants. All of these are not supposed to be effects of all of the pollution indicators, but rather populations that are likely to be particularly sensitive to them. And then the socioeconomic factors that were included include education, housing burden, linguistic isolation, poverty and unemployment. And there are a lot of other things that we could include, but that will be included in future iterations, but that's the current ones. And each one, one of the things that's unusual about this, US EPA has EJ Screen, and they map a lot of these kinds of things. The effort in California was figure out a way to combine them into a single indicator. That's the thing that's somewhat novel and also a little bit controversial. The indicators are each scored according to percentiles, and then the percentile relative scores, so basically each census tract in the entire state is ranked for each indicator from lowest to highest, and then scored. And then the nice thing about that is it's pretty intuitive. In other words, if you're in the 75th percentile for diesel particulate matter, then you're worse off than 75% of the census tracts in California in terms of that indicator. So people kind of get it. And then I actually took out the slide that shows the multiplication, which is interesting, where the exposure indicators are multiplied against the vulnerability indicators, because risk is often considered to be something that is basically a multiplier. There's a lot of data on that, and we actually came up with a whole formula for it, but I won't get into the details on that. It's certainly available. If you Google CalEnviroscreen, it's probably the best way to get to it. And the fun thing about the map is that it's very interactive. So you can look at it in Google Earth, you can look at it in ArcGIS, you can look at it just on the web interface where you can zoom into the communities, you can click on any of the 8,000 census tracts and find out how it scores for each individual indicator and overall. You can also find out additional information about those census tracts. So you click on a census tract, you get a pie chart of the race and ethnicity breakdown within that community and the age breakdown, looking at children and elderly in that community. So you can actually find out what the demographics are, each indicator is also available as separate maps. So if you're just interested in drinking water, for example, you can just look at the drinking water layer. But if you want a sense of really overall how it all comes together, you look at the final results map, and then you can get that view. And the thing that I find particularly gratifying about this is not the actual project of creating the tool, but the fact that it actually has been used and is being used. So in California, there is a rather massive greenhouse gas reduction fund that has been created through our carbon greenhouse gas auctions and the cap and trade program that is in place. And that those billions of funding are and will be available and allocated specifically required by law to be allocated according to community disadvantage, with 25% of funding required to be located within disadvantaged communities, and then an additional 5% to projects within this sort of half-mile buffer of disadvantaged communities. And then the actual statistics have been a lot better than that. So about almost 40% have been going, of the money has been going to disadvantaged communities. There's also an environmental justice task force that's focused on enforcement issues, looking at all of the environmental laws just to make sure that that all of the facilities within the communities are in compliance. And then small grants that are going to community organizations within those communities, and then a whole series of other efforts ranging from solar panels to weatherization upgrades to transportation and urban forestry that are being focused on these communities. The question is going to be, will we see an impact? Will we actually be able to measure change? One challenge, of course, is since I mentioned that all the communities are graded sort of on a scale against each other, we will have to figure out a somewhat different scoring methodology, which we're working on, to figure out if, to be able to see those changes over time. There are a lot of other approaches to cumulative impacts in communities that are being developed, ranging from, you've heard many mentions of some of these sensor technologies, some of which are in the image at the bottom. Very small, very portable, connected to smartphones, able to stream data constantly, and can be used both indoors and out, which are great, very inexpensive. Some of them are being used in communities right now for environmental monitoring. And in addition, there's a big effort in the biomonitoring world to look at semi-targeted and non-targeted biomonitoring, which instead of looking for certain chemicals in people, you can actually look at, with the question of, well, what chemicals within this sort of set of parameters are in people? And you then can identify some surprises and use those to prioritize efforts. There are also other efforts in place, and this is from a paper by Ken Olden, the interesting visual on the right, laying out this concept of a community-specific epigenome that might be able to allow us to identify how these cumulative impacts are affecting individuals. So these are all things for the future, and I'm optimistic, actually, that with all of these tools, we will be able to really make change at the community level. Thank you.
Ben?
Ben Hobbs from Hopkins. Oh, thank you. This is for Gina. All the presentations are great. I couldn't figure out which person I wanted to ask a question about. This sounds like a techie question, but it might have big implications for equity, and that is the scaling, the 0 to 100%. So that makes the difference between 99% and 90% the same as the difference between 40 and 49. But the folks in the 99th percentile might be getting 10 times the exposure of the 90th. And I'm just wondering whether different scales might make a difference in terms of identifying places that are at risk.
That is a great and sophisticated question. I'm impressed that you picked up on that. It's a problem, actually. The degree of difference, or the degree of length of the tail, varies a lot depending on the indicator. Some of these indicators have huge long tails, where the 99th percentile community is way, way more impacted than the 95th percentile community. And other indicators don't have that degree of skewness. And so we've actually done a fair amount of work trying to figure out whether there's a way to, because in some ways this does over-normalize the distribution, and you're pulling in some of these communities and making them not look quite as bad as they are. What we've found is that the communities in that, that top highest percentile show up, as disadvantaged, certainly end up in the top, 5 to 10% anyway. And so we concluded it didn't have that, it actually didn't create that much of a difference, but it is an issue, and we're trying to figure out if there's something that we could do to really zero in on those most affected ones.
Hi, everyone. Thanks for your comments. So I've been trying to think a lot about primary prevention, right? In the 2000s, I don't think we have too many chances to make big systemic decisions and get them wrong again and again. And so I was wondering, this whole idea of problem formulation and getting the problem right, we need to prevent problems, not to wait till they happen and then identify them correctly. So I would wonder if you would think about, if we applied systems thinking, all the different ideas that were suggested today, I think many of us would have come to the conclusion that the fracking revolution was something that we probably shouldn't have done. So how could we have prevented it in today's world? I've listened to all your presentations, and I'm wondering, we allow it to happen, and then we can sort of look at it and try to make arguments to after the fact. But if you look at the history of environmental health and public health, it takes 1 or 2 generations to fix incorrect decisions. What could we have done in the frameworks that you guys presented today to have prevented the fracking of tens of thousands of wells in the era of climate change in the Anthropocene?
So in some ways, broadening our thinking. So we have a planet and a population that require energy. And I think, part of the challenge is looking at a variety of avenues for obtaining energy, and to do it in a way that meets the need, but minimizing the impact on the environment. And so I don't know that we could have avoided hydraulic fracturing. The technology has been evolving since, the late 30s, early 40s. And it got to a point where it became more cost-effective and more viable. And as you look at world politics, and you look at some of the challenges with different oil cartels providing resources, so how could the U.S. defense policy be, we're looking at national security, so how can we ensure that we're going to have energy to meet our population? So with that as a driver, I don't know that we could have avoided it. But what we could look is, so what are all the other kinds of energy sources out there? And can we do more with solar, with wind, in a cost-effective way? Are there other types of hydroelectric, geothermal, the whole suite of energy? So Anyway, my personal opinion is I'm not sure we could have avoided it. I think the goal that we've had, particularly within EPA, is given that it is happening and looking at how can we improve practices, how can we work with industry, work with all of the other groups, improve practices that's going to minimize that impact on the environment.
Howie, you must have something to say.
Well, I was going to jump in, Brian, but I actually, a lot of this has been covered. In a way, green chemistry is a model for this. If all of your thinking is blueprinted based on the future that you want to arrive at, you approach problems differently than what we've typically done. So if it comes to making chemicals, if your starting point is make safe, sustainable chemicals, then you design accordingly. If you start with an image of the energy system that you want, which means lower per capita use of energy and relying entirely on renewables, and you backcast from there, then you wouldn't be exploiting new sources of fossil fuels. You'd be moving toward renewables. And that's going to mean a lot in terms of technology development, like batteries. It's also going to mean a lot in terms of incentives and pricing structures for the industry, so that it's in the industry's interest to move in that direction. So I think having that big picture of where we want to get, and then designing to get there, either at the level of chemicals or big issues like transportation and energy systems, is the way to go. This is really about aspirational thinking. That's what we're all here to do, right?
Gina, did you want to add anything?
There are other questions, so.
Yeah, okay. Tad?
Tad Aburn, Air Director with MDE, and I'm an engineer by training. I'm a systems engineer. Great set of presentations, and this sort of carries over to Dr. Burks as well. So I'd like to get your input on expanding sort of the systems approach to public health protection. And when I say that, I'm a frontline regulator. I'm a risk reducer. And what drives my job is risk reduction. So if you put that up at the top, the big goal, risk reduction, we have these imperfect political systems and these imperfect legal systems, and we have imperfect data. We have public perception issues that are difficult. If you add all of those things into our system and you try to balance all of that out, sometimes where you end up is making a move that's directionally correct, that really does a lot of risk reduction, but you don't know if it's the perfect answer to a difficult question. Is that in any way part of this sort of systems thinking process where making progress and reducing risk is a value that the academic community is looking for? Because sometimes I find myself in situations where the desire to have perfection ends up being the enemy of the good. And I'm in an argument with the academic community over methane right now, where we're making really good steps to reduce methane leakage, but it's not perfect. So could you guys comment on that?
I love the question. I come from Seattle, which is a hotbed of tech entrepreneurship and a lot of newly rich tech philanthropy. And one of the problems with this is the belief in silver bullets, in perfect solutions, in magic solutions. Every philanthropist is now looking to put money into the big thing. It's a different mentality than adaptive management of complex systems, as you're talking about. Tweak a dial here and then look at the ramifications through the system and see if things got better or not, and then manage adaptively. I think you're calling for the latter kind of system management, but that means moving beyond the mythology of silver bullets. In the public health world, the smallpox metaphor, which is the wrong metaphor now. So I think we need to think in those terms, and we probably need to be training the next generation to do adaptive management of complex systems, something that you know intuitively from your work, but a lot of us haven't yet learned.
Marcia?
So I think that we're all here because we sort of believe in the same issues. Over the last year since the election, we've had a lot of conversations about how did we not effectively communicate our values and mission. So I want to ask each of you, how do we do a better job of engaging citizen scientists?
question. Wow, that's a great question. So, I think that there is this issue of getting to people where they're at, as they say in New Orleans, and getting sort of identifying what issues, because often, all of these issues actually do kind of start local. People are looking around them. They're looking at their community and their home, their job, their neighbors. And so people have different sets of worries and concerns. But almost, I'd say most people have some worries and concerns that relate to the environment and environmental health. And so the question is, how do we sort of create resonance around that? And I think the thing is that all of us are thinking globally. We're thinking about the really big, wicked problems that are staring us in the face in the next generation or our current generation. Most people out there are not. And so the challenge, I think, for all of us is how do we think, it's like, okay, yeah, think globally, act locally, right? It's kind of what I'm saying, is that...
That's a catchy phrase.
Yeah, gee, I guess I just came up with that. But can we do that? Can we do it more effectively? And I think that's something actually that Gina McCarthy and actually Lisa Jackson, her predecessor, were trying to do, and we're actually making some headway on. Unfortunately, it didn't quite get far enough, fast enough, and that's part of the problem of working locally, is that it's slow. And we don't have a lot of time. So that's where I'm struggling, is how do we accelerate that process by making it sort of take off in communities all across the country simultaneously when we have a small public health workforce with not a lot of resources behind it.
Unfortunately, we're almost out of time if you want to wrap up quickly.
I was just going to add, I think complacency is probably the biggest challenge we have with the public. And they don't seem to pay attention to environmental issues until there's a crisis, whether it's a Gold King mine or a Flint or a Toledo. And so where we can make environmental stewardship real, where communities can see the impact that they have by an action that they take, and they see the benefit. And then, look at what's happened with, whether it's with gun issues or Black Lives Matter, where we can take advantage of social media and spread that, and really reignite a new kind of activism for public health protection.
Great, thank you. Please join me in thanking our panelists. Great, so thanks Kirsten, and to all of those three panelists, and to all of you for this good start in discussion. I know you're all eager to continue it. So just a few notes on the logistics of the breakout session before I set you free to the break. There will be these little tent cards that we'll put on the tables that you're sitting at now. So you'll want to take your things and move to your assigned table when you come back from the break. And there will be a moderator at your table who has some questions to help guide the discussion. And we will be looking for a volunteer at each table to take notes on a few key points that your group wants to report out, and ask that person to send those to Megan when your group concludes. So you'll have about an hour together, and we'll encourage you to spend about the first 45 minutes discussing around those questions, and then take the last few minutes to kind of step back and look at the points that you've come up with and try to call out the top 3 to 5 or so that you really want the rest of the group to hear coming out of your discussion. So you should have a dot on your name tag that guides you to your table. A few of you may not have a dot. In that case, just look for a table that looks like it needs a few extra folks at it.
I think the transportation group maybe is a little bit on the smaller side, so they'll be taking additional members. And we will break for 15 minutes, come back at 10:45, and look for your matching table.